Did you know there's a test that could reveal how at risk you are for heart disease and maybe alert you years in advance so you could take steps to prevent a heart attack? Well, there is, and I had it done with the doctors at Central Connecticut Cardiologists at Radiology Associates in Bloomfield. Take a look.
It's a CAT scan for your heart that can reveal your true risk for a heart attack.
This is a coronary artery calcium score, and what it is it's a CAT scan of your chest, specifically looking at the coronary arteries. And the radiologist is able to pick up calcium, which is a marker for plaque. And so we use this test for patients who we don't know if they have heart disease, perhaps they have a risk factor or a family history, and this helps us identify, are they at risk of having a heart attack?
Calcium sounds like a positive thing when people hear it. Why is it bad if it shows up on the scan?
So the way it works is you can see the calcium because it's bright white like bone, and normally your body deposits soft plaques in the arteries, but over time those plaques become calcified. So calcium is a marker for plaque burden.
The higher the score, the higher the risk of having heart disease, but knowing your risk means you can lower it.
We can compare it to somebody of your same age and gender and to determine what is your risk of having heart disease.
Why is that empowering?
It's empowering because it's a prevention strategy. So we can put people on medications before they have a problem, before they have a heart attack, and people can really take it seriously and improve their diet and increase their exercise.
Do we have to worry about radiation?
There is some radiation associated with this procedure. It is, in fact, actually quite minimal.
Now that I know how easy, painless, and effective the test is, I'm ready to get my scan.
My name is Renee. I'll be doing your scan for you today.
Okay.
We're going to be doing the CT calcium score.
Okay, so just come on over here and lay down.
So you're going to lay down on your back, head up on the pillow. Just be careful, there is a slight dip in our tables. But I'm going to put these 4 stickers here on your chest, 2 up top, 2 on the sides. That helps me get an idea of what your heart rate is, like he was telling you earlier.
Kind of like an EKG?
Correct.
It doesn't hurt at all.
It's sort of like a nap, right, Renee?
Yeah, kind of is actually.
All right, bye-bye.
The team sets the test in motion from the other room. I just have to follow the breathing instructions.
Okay, Carol, we're going to start with that first scan now.
Okay.
Please breathe in. Breathe all the way out. Breathe in. And hold your breath.
And it's over.
That was totally comfortable, and it was so fast.
Yes, yeah.
Okay, so now we get to go find out what it says.
Yeah, that's right.
The good news is that your calcium score is 0.
0.
0.
This is when you want to have a 0.
Exactly, one few times in life that you want to be a 0.
A 0 score doesn't necessarily mean 0 risk of heart disease, but it does mean I'm doing well as is and don't require any treatments. The recommendation would be test again in 5 years. You have to ask your doctor to order this test, but the doctors at Central Connecticut Cardiologists say it's a good idea and anyone can get it for under $100.
This is not covered by insurance, but it's inexpensive. It's $99.
That's right.
But not anyone can get it. You have to ask your doctor first, right? So
that's right.
Who should get this? What kind of conversation do you need to be having?
So I think if you don't know if you have heart disease and you want to know your risk of heart disease, then it's a conversation you should have with your primary care doctor or with your cardiologist.
For more information, go to CT.Cardiology.com. The center often holds screening events. Last month, they gave one to give healthcare workers the scan for free.